And what are the risks and limitations of a rhinoplasty?
The risks really are very few and in terms of severity. The 5 things that I worry about with any surgery that I do, and basically any other surgeon would say the same thing, are abnormal scarring, infection, bleeding, asymmetry, and nerve damage. Those are the 5 things that we tell people are universal to surgery. And abnormal scarring after a rhinoplasty can happen, but it's extremely unusual. It's certainly not something that would be visible because the incisions are not visible. So that's not an issue that I've actually ever had to deal with directly. Infection I've seen in over 25 years, I think I can call one. Maybe there's one I've forgotten about, but with the thousands I've done over the years, and obviously that's pretty rare. So that's because the midface, especially the face in general, but the midface in general, or in specific, is blessed with an abundant blood supply, and infections just are rare. Bleeding is something that can occur after any surgery. I've only had 1 or 2 patients that I've had to take back to the operating room to stop bleeding after rhinoplasty. One of them actually was a medical student who didn't follow my directions. So that's very, very rare. Everybody has a little bleeding after surgery. Abnormal bleeding is when they start bleeding profusely with clots, and we have to take them back to the OR, which is, like I said, extremely rare. Asymmetry is more of a given. I always put that in there for any procedure I do, especially on the face, because most people don't realize that God made their face bigger on one side than the other. Perfect symmetry is almost unheard of. I'm certainly asymmetric. Got a crease in this ear and not one here, and this chin's lower, this one's this ear is different than that ear. Everybody's asymmetric, so I always put that in there so people realize that they started asymmetric, and they can never, I can never promise perfect symmetry. Nerve damage occurs anytime that you elevate the skin. You're going to have temporary numbness of the skin that you've elevated. That's no different than a rhinoplasty, but permanent nerve damage is I've never seen. So those issues are extremely rare. What's common, unfortunately, after rhinoplasty is the need to go back and tweak it, what people call a revision rhinoplasty. If you take all rhinoplasty surgeons around the world, the revision rates approaches 30 to 40%. So I would consider that a risk of rhinoplasty. Fortunately, in my practice, my revision rate's only about 2 to 3%, which is not because I'm Michelangelo, but it just is due to the fact that I've been doing this 25 years and I specialize in this area. So my numbers and experience are far greater than the average plastic surgeon.